Brain cancer is a natural healing process of the body after you have been through intense stress. If you let go of the stressful conflict, you may stop the brain tumor from growing. In this video, you will learn some basic info about the brain. Then you're going to learn what brain cancer is and why some people get it. So let's start. Every animal has a brain. The brain performs an incredible number of tasks. It controls body temperature, blood pressure, heart rate, and breathing. Your brain also analyzes massive amounts of info from your various senses. The brain handles your physical movements. It also lets you think, dream, reason, and experience emotions. It regulates all conscious and unconscious aspects of your life. Your brain consists of about 100 billion nerve cells called neurons. Neurons can gather and send electrochemical signals to each other. They share the same characteristics and have the same makeup as other cells. But the electrochemical aspects lets them transmit signals over long distances. Neurons have three basic parts such as the cell body or soma, axons, and dendrites. The axon is part of the cell that carries the electrochemical message along the length of the cell. Axons can have a thin layer of myelin that works as an insulated electrical wire. Myelin consists of fat and protein that helps the transmission of the nerve impulse down a long axon. Dendrites or nerve endings make connections to other cells. This allows the neurons to talk to each other. Neurons come in many sizes. They also have different shapes depending on their functions. Some of the nerves in the brain go right to the eyes, ears, and other parts of the head. Other nerves connect the brain with other parts of the body through the spinal cord. Together the brain, spinal cord, and nerves form the central nervous system. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. The cerebrum is the large outer part of the brain. It controls reading, thinking, learning, speech, emotions, and planned muscle movements like walking. It also manages your vision, hearing, and other senses. The cerebrum has two cerebral hemispheres or halves. The right half controls the left side of the body and vice versa. Each hemisphere has four sections called lobes. These are the frontal, parietal, temporal, and occipital lobes. The brainstem at the bottom of the brain connects the cerebrum with the spinal cord. It includes the midbrain, the pons, and the medulla. The skull and meninges protect the brain, and the bones of the spinal column shield the spinal cord. According to Western medicine, brain cancer is when too many cells grow in the brain tissue. If cancer cells grow to form a massive tumor, they can interfere with various brain functions. You may have trouble with your muscle control, sensation, memory, or other functions. Brain cancer occurs in about 1.4% of new cancer patients per year. Most brain tumors get their names after their brain tissue type. Doctors grade tumors depending on how the cells in cancer appear under a microscope. Surgery, radiotherapy, and chemotherapy are the primary treatments for most brain cancers. The medical establishment has no idea why brain cancers manifest. One of the reasons why we get cancer is because of stress and emotional trauma. How you react to stress is one major factor in the development of cancer. Suppressed anger is the most common trait in cancer patients. Many cancer patients had a stressful childhood. They often felt rejected by one or both parents or didn't get treated well. Therefore, they have a tremendous need for approval and acceptance. Because of their emotional wounds, they are more sensitive to stress. Our thoughts and emotions have a powerful effect on our health. One German doctor figured out why the body manifested cancer. His name was Richard Hammer. Hammer worked as a doctor at a cancer clinic in Munich in Germany. He got testicular cancer after his son died. Before that, he had perfect health. So he wanted to know if emotional stress had anything to do with his cancer. Hammer then asked his cancer patients questions about their emotional distress. All his patients experienced different unexpected conflict shocks before their cancer diagnosis. Dr. Hammer also obtained brain scans of all his patients. He discovered that different areas of the brain controlled various organs and glands. Hammer found out that every cancer has a distinct conflict shock. A conflict shock is a traumatic experience that we can't anticipate. At the moment of the trauma, the conflict shock impacts a specific area in the brain. The subconscious mind analyzes the situation and then decides what program to run. This association happens in a split second and on a subliminal level. The symptoms reveal how it deciphers the situation. Our past experiences, social conditioning, values and beliefs affect the interpretation. On a brain CT scan, you can see the impact visible as concentric rings. German New Medicine calls them hammerheads. Hammer also learned that diseases run in two phases. We have the active conflict phase that activates the moment we have the shock, and at the moment we resolve that conflict, we enter the healing stage. Every biological program are there to support the organ during the crisis. The conflict runs in the psyche, the brain, and the organ at the same time. Our brains can't see the difference between a real situation and an imagined one. So thinking about a problem can thus activate the same programs. Conflict shocks always start from real-life circumstances such as problems with a spouse, death of a loved one, troubles at work or school, financial difficulties, worries about a family member, or concerns about oneself. The location and size of the hammer focus depend on the nature and intensity of the conflict. Hammer also discovered that the brain reacts differently if we are right or left-handed. It determines whether the conflict impacts the right or left side of the brain, or whether a symptom such as breast cancer occurs on the right or left side of the body. A person's gender and hormone status also affect the type of disease you get. In the conflict active phase, the body experiences stress. Your heart beats faster, your blood pressure goes up, the digestion slows down, or you experience frequent urination or have no appetite. Typical signs of conflict activity are cold hands, cold sweats, and shivers. These reactions are due to constricted blood vessels. This is also called the cold stage. If the conflict activity is long-lasting, it may lead to cancer. Cancers are not malfunctions of an organism. Instead, they are there to support an individual during their crisis. In lung cancer, for example, the extra cells boost the capacity of the lungs. Colon cancer increases the production of digestive juices, and breast cancer cells allow a female to provide more milk for a sick baby. Your condition becomes chronic if you don't resolve the conflict shock. Hammer calls it a hanging conflict. Many people have hanging conflicts with little or no symptoms. Lasting intense conflict activity drains the body of energy and may lead to death. The resolution of the conflict is the turning point of the healing process. In the healing phase, the autonomic nervous system starts to rest. Your increased appetite provides the organism with the necessary energy for healing. If the healing phase is intense, the tiredness could be so overwhelming that you can hardly get out of bed. Your pulse and blood pressure start to go down. The blood vessels expand, causing warm hands and skin. This is the warm state of the healing phase. During the first part of the healing phase, the affected organ goes back to normal. Tumors that develop in the conflict active phase stop growing. Microbes break down the extra cells that are no longer required. An edema forms at the site to protect the area that is healing at the time. It contains water which causes swelling. Fever and inflammation are other signs of the healing process and may cause pain. The intensity of the healing process depends on the severity of the prior conflict. Symptoms on the related organ might not create enough water retention to make it painful. Neurons also undergo a restoration process parallel to the psyche and the organ. There is slight damage to the neurons within the specific brain relay. As with the organ, water and serous fluid go to the damaged neurons to protect them. This natural process creates a brain edema. The intensity of the previous conflict determines the extent and size of the edema. Western medicine diagnoses the growing brain edema as a brain tumor. It's the swelling of the brain edema that causes symptoms such as dizziness and headaches. They can feel like dull pressure headaches. Sharp stabbing headaches happen in the second healing phase. Once the body expels the brain edema, the mechanical pulling on the meninges may cause sharp pain. The expelling of the brain edema is vital as it relieves the brain pressure. During the epicrisis, the body eliminates all the excess fluid through the urine. If you have conflict relapses, the edema remains until you fix the problem. The symptoms you experience depend on the nature of the conflict and the affected organ and brain part. A brain edema in the motor cortex may cause muscle cramps or spasms. If it affects the sensory or post-sensory cortex, it generates dizzy spells or loss of consciousness. Some epicrises can be dangerous when the conflict active phase was long and intense. In the second part of the healing phase, scarring occurs through the production of collagen. After the brain edema disappears, glial cells increase at the site to finish the job. Glial cells repair a damaged brain after a brain injury or surgery. They also help restore the area in the brain that received the impact of a conflict shock. During the healing phase, glial cells form an insulating layer. This repair work is crucial to ensure a normal function of the organ connected to the brain relay. Whereas the medicine wrongly diagnoses the natural buildup of glial cells as a brain tumor. They give them terms like glioma, glioblastoma, or astrocytoma. If there is a lot of glial cells, they say it is an aggressive tumor. And if they find more than one tumor in the brain, they diagnose it as multiple brain metastases. Dr. Hammond showed that so-called brain tumors are not cancers. Instead, they are part of a natural healing process. The surgical removal of a tumor does not stop the healing process. This is why brain tumors come back. After the excision, the surgical cavity forms a cyst. A brain cyst forms when you interrupt the healing phase with new conflict relapses. The brain edema contracts and expands if you have recurring trauma. This might make the brain tissue rigid and inflexible. At one point, the tissue ruptures, resulting in the formation of a fluid-filled brain cyst. The tearing might cause brain bleeding. Chemo treatments have the same effect. Each chemo and radiotherapy regimen stops the healing process. If you have a brain tumor, then take your brain scan and compare it to the German New Medicine's brain chart. You can download a PDF of the 5 biological laws of the New Medicine in the link below. After you have downloaded this document, look at the brain charts and the organ connection. Compare your brain scan with the brain diagram to figure out the brain-organ link. After you have figured out the organ involved in the conflict shock, go to learninggnm.com. Click on the menu option. Choose Index A to C. Select what organ or disease you want to learn more about. For example, in this picture, you can see the healing phase in the area of the brain that controls the cervix. You can then read the causes of cervix problems. Use this info to know what you need to work on if you have conflict relapses in the brain. Your brain consists of about 100 billion nerve cells called neurons. The brain performs an incredible number of tasks each day. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Every cancer manifests after that is in conflict shock. There's an active conflict phase that activates the moment we have the shock, and at the moment we resolve that conflict, we enter the healing stage. A brain edema contains water which protects the area that needs healing. A brain cyst forms after an excision or if you have conflict relapses. If you let go of the stressful conflict, you may stop the brain tumor from growing. If you enjoyed this video, then press the like button and subscribe to the channel. Share this video on social media with all your friends and families. Please visit our blog at cancerwisdom.net to learn non-toxic ways to treat cancer. You can also download free documents from our free resource library and learn other ways to prevent cancer. Thanks for watching, and I'll see you soon.